name is Debbie Williams, and I'm a registered nurse and founder of my clinic, Alternative Hormone Solutions. Today I'm going to be talking about a condition many of my ladies have when they come to see me, anxiety. Many women operate in a state of low-grade anxiety that may erupt into episodes of panic attacks, phobias, or anxiety disorders in the face of increased stress or biological changes like monthly periods, the birth of a child, perimenopause, and of course menopause. Over time, women who are chronically anxious may come to regard constant anxiety as being normal. Most of my patients with generalized anxiety are so accustomed to living with it that they don't even mention it until I ask or until they enter perimenopause and their long-standing anxiety symptoms actually worsen. Now, psychologists once viewed anxiety as a purely emotional problem, but over 30 years of research demonstrates that anxiety has real physiological causes. This is especially the case with anxiety related to hormonal imbalance, an amazingly common cause of anxiety in women of all ages. Other physiological causes can be adrenal imbalance, thyroid issues, and even digestive imbalances. This means you don't have to live with ever-present anxiety or medicate your symptoms when feeling overwhelmed by them. Once you understand both the physiological and the emotional causes of your anxiety, you'll see there's a lot you can do to resolve this problem. Now, what is anxiety? Everyone experiences anxiety from time to time. Our ability to feel fear is like a built-in alarm system that brings the full weight of our mental and physical prowess to bear whenever we sense danger. This acute fight or flight response triggers a complex interplay between the mind and the body to deal with a perceived threat, whether it's real or whether it's imagined. What's not natural or healthy is to remain on perpetual high alert emotionally and physically when our lives are not at stake. Now, anxiety symptoms. Symptoms of generalized anxiety and panic attacks may include irrational fear or dread, muscle tension, headaches, jaw clenching, teeth grinding, insomnia, restlessness, nervousness, fatigue, feeling that you can't get a breath, feeling kind of choked, nausea, diarrhea, heartburn, even irritable bowel syndrome. The chest pain or pressure, elevated heart rate, palpitations are very common with anxiety. Just feeling jumpy or irritable, even twitchiness, or just feeling yourself do the fine shakes. Sweating or sudden changes in body temperature, hot flashes can also be caused by anxiety. Feeling tearful, depressed. 2/3 of people with anxiety disorders also suffer from some depression at some point in their lives. This is by no means a comprehensive list. Anxiety manifests in women in so many different ways. What you usually don't feel when anxious is tired or hungry until you eventually crash, and then you start craving sugar, maybe alcohol, and other comfort measures to soothe your frazzled nerves. Sometimes these symptoms can also indicate hyperthyroidism, so be sure to ask your healthcare provider to rule this problem out if you have the above symptoms. Now, chronic anxiety symptoms can run the gamut in intensity and impact, from vague background noise to rendering someone actually incapacitated. Severe anxiety disorders include obsessive-compulsive disorder, post-traumatic stress disorder, panic attacks, and even social phobias. Now, these conditions afflict only a small minority of anxiety and sufferers, and fortunately, they are highly treatable after medical diagnosis. Now, mild to moderate anxiety or generalized anxiety disorder is far more widespread, but harder to diagnose than severe anxiety disorders. This is the ever-present tension that is more common than ever among women these days. Now, generalized anxiety disorder is characterized by compulsive worrying and physical symptoms of anxiety that persist for more than about 6 months. While anxiety can be debilitating, mild to moderate symptoms may not obviously affect a woman's ability to function. In fact, it's often the high-achieving together woman who has chronic anxiety, though it may be very difficult for her to admit it. Even women who rarely felt anxious during their youth may develop anxiety and panic attacks as they enter perimenopause and experience these hormonal changes. This is a wake-up call to change one's life. Now, how does an ordinary anxious feeling become chronic anxiety? Like a tangled up knot of emotions and physiology, the origins of anxiety are often found rooted in both. But the feeling of anxiety always begins with stress, a trigger that initiates fear in what's called the limbic system of our brain. At the first whiff of apparent danger, your brain chemistry, blood hormones, and cellular metabolism all kick into action. With chronic anxiety, the intensity of this response may be less dramatic, but it never really shuts off, even though there's no persistent threat. Over time, symptoms may be generated by seemingly minor everyday events because your limbic and nervous systems have been sensitized to react to them as emergencies. The biochemical state associated with anxiety can then come to seem as normal, a state that is maintained by your neurotransmitters, your hormones, and metabolism at the expense of your health and your happiness. Now, leading psychologists believe that emotion of each of our memories is chemically encoded by a part of the brains called amygdala, the nut of worry, and that every time we retrieve a memory, for better or for worse, that memory is changed, actually chemically altered. A history of adverse experiences in childhood can set us up for a lifelong pattern of chronic anxiety, from the overt trauma of emotional, physical, or sexual abuse to a parent's death, divorce, or emotional modeling by an overly anxious, controlling, or alcoholic parent. When dreadful things happen to us as children, we may lack the skills to process them. It's as though the adverse events are trapped inside us, resurfacing as anxiety symptoms when we're adults. I have found that the majority of my female patients who have a real tough time in perimenopause have had childhood trauma. Now, medication for anxiety is being prescribed with abandon. Scared of flying, you take a Xanax. Can't sleep, you take an Ambien. You're nervous at parties, pop an Ativan. For severe physical symptoms of anxiety, a limited course of medications sometimes may be required, but we don't recommend it for generalized anxiety. Why not? First of all, anti-anxiety medications are highly addictive. And secondly, they do nothing to reboot the neural and hormonal pathways for long-term mental health. They simply disrupt the pathway and mask the symptoms so you can function. It puts the Band-Aid on things. Third, in some cases, particularly in older women, drugs like Xanax and Ativan can actually make symptoms worse. In other words, anti-anxiety medications are just not a workable solution for the long haul. I believe the vast majority of women with anxiety symptoms do not need medication. From initiating helpful lifestyle and dietary measures to learning new relaxation techniques, using bioidentical hormones and some supplements, there are many safe, effective, natural anxiety treatments that provide lasting relief. Women have been told that anxiety many times is all in their heads. If we could only just think right, we'd overcome the problem, get over it. But we now know that anxiety is a body-wide phenomena. The origins can be traced into not only your brain, but to your adrenals, thyroid, your gastrointestinal system, your heart, your ovaries, and even your bones. And of course, they're all interrelated. But given that neurotransmitters and hormones are messengers of anxiety, let's start there. Now, neurotransmitters and anxiety. A neurotransmitter imbalance can sensitize your brain, making you more prone to fear and response. Now, if you get consistently high levels of excitatory neurotransmitters, the ones that really get you going, and the adrenaline and the epinephrines, the noradrenalines, the norepinephrines, and corresponding low levels of the calming inhibitory neurotransmitters, the brake, such as serotonin and GABA, can actually alter the brain's circuitry. Now, as above, this alteration can develop over time as the result of acute or repeated trauma or simply a life of low-grade chronic stress, particularly when coupled with a genetic predisposition. Now, popular anti-anxiety medications like Buspar, Ativan, Valium, Xanax work on these neurotransmitters and the receptors, as do caffeine and alcohol. Caffeine raises adrenaline and dopamine levels, whereas alcohol raises dopamine levels and binds to these GABA and serotonin receptors, amongst others. Now, anti-anxiety medications, particularly the benzodiazepines, caffeine and alcohol, they're highly addictive. People who inherit or develop anxiety-sensitive brains also have a greater risk for addiction. Now, when you feel anxious, which is an emotion, your sympathetic nervous system jolts you into action as a very physical response. This stress response is mediated along what's called the hypothalamus pituitary adrenal axis. Your hypothalamus releases a hormone called corticotropin releasing factor, which flows to your pituitary gland, which stimulates another hormone called ACTH, which in turn tells your adrenal glands to release epinephrine, adrenaline, and cortisol. Together, these hormones, some of which have dual roles as neurotransmitters, by the way, elevate your blood pressure and your blood sugar to give your brain, your heart, your muscles, and skeleton the edge they need to respond to crisis. Meanwhile, they also suppress the less dire bodily functions like immunity, digestion, and bone building, which is why chronic anxiety chips away at your health foundation over time. In a healthy system, the stress hormone flood recedes once the threat is disabled. But if the gates stay open, the adrenals become tapped out, resulting in chronic anxiety, depression, weight gain, accelerated aging, osteoporosis, and many other metabolic imbalances. Many of my patients with high anxiety have elevated levels of C-reactive protein, which is an inflammatory marker, epinephrine, and cortisol, which indicate that this response is always turned on. This fight and flight war system, it's like a war is going on. And women are more than twice as likely to feel anxiety, especially during the PMS, perimenopause, and menopause. Anxiety is often the first sign of perimenopause setting in. For example, women with moderate anxiety are 3 to 5 times more likely to experience hot flashes or night sweats. Progesterone has a particularly soothing effect on your system, similar to and interdependent with serotonin. When levels of progesterone begin to drop as women approach perimenopause and menopause, this can leave her susceptible to anxiety-related problems, including insomnia. As women approach menopause, estrogen levels and progesterone levels often fluctuate widely and amplifying any existing symptoms. And in my experience, relief from menopausal and perimenopausal anxiety and panic attacks can only be gained once hormonal balance is restored. Now, let's talk about digestion and anxiety. As I ask a patient with a lot of patients I see have gastrointestinal problems, I ask them to share a little more about what's going on in their lives, and she will almost invariably identify some component of anxiety. But whether it's nervous stomach, heartburn, the irritable bowel syndrome, gluten intolerance, diarrhea, ulcers, nausea, bloating, bleeding, anxiety does not necessarily precede a digestive concern. Although anxiety was blamed for generations as the cause of stomach ulcers, for instance, we know now there's actually a bacteria called H. pylori that's the primary causal agent. Yet the very fact that a patient has an ulcer or any other gastrointestinal problem can precipitate anxiety, which can then set up a vicious cycle of symptoms. Our grasp of the web-like connections between our emotions and gut health is still in its infancy, but we do now recognize that the digestive symptoms as an independent center of nervous activity intricately connected with brain chemistry, hormonal balance, and moods. In essence, we have a second brain in our belly. Indeed, the gut is even a major site of serotonin production. We produce serotonin in our gut and it utilizes it there, where it functions as an enteric neurotransmitter. So clearly, anxiety isn't always in our heads. And in the over 20 years of practice, I've seen many women recover from this problem without resorting to mind-numbing drugs. Relief from chronic anxiety comes from restoring your body's natural equilibrium by learning to process your emotional history while making changes to lifestyle, nutrition, exercise habits, and hormonal balance. So here are just a few recommendations. Now, of course, fresh air, sunshine, and exercise. A healthy measure of each will not only help you to manage better when under pressure, but aids restorative sleep at the end of the day. No need to overdo it. You want to soothe your nerves, not add stress. Deliberate dietary choices. Now, sound nutrition so heavily influences our hormones and neurotransmitters. It's simply a must. Eat the majority of your protein early in the day. Choose whole nutrient-rich foods with a low glycemic index, low sugar index, and don't let yourself get too full or too hungry. 3 simple precepts to normalizing your 2 major hormones, insulin and cortisol, which in turn will help optimize your neurotransmitters and balance your sex hormones. Eliminate potential food allergens. Gluten, for example, is notoriously associated with anxiety. If you're experiencing anxiety-related gastrointestinal problems, elimination diet may help you identify sensitivities that are at play. And definitely consider nutritional supplements. We encourage all women with anxiety symptoms to take a good quality magnesium and B complexes. Some nutritionists regard the B complex as the most important nutritional factor for healthy nerve cells. There's also evidence that omega-3 fatty acids can help reduce symptoms of anxiety. I particularly like krill oil, very effective for women with PMS. Likewise, vitamin D is a key nutrient for mood, and deficiencies are widespread. If you're elderly, overweight, dark-skinned, live in a higher latitude, that's in Canada, or don't get much sun, vitamin D testing and appropriate supplementation is strongly suggested. And balance your sex hormones. When anxiety is related to perimenopause or menopause, gentle endocrine support can often restore balance. We recommend bioidentical progesterone for most women who have estrogen dominance. Progesterone stimulates GABA, which is a very important calming neurotransmitter, and gives us a sense of calmness and relaxation. Now, low progesterone may result in anxiety because of lack of GABA receptor stimulation. Women call progesterone the happy cream. Now, about your emotional work. Just as you develop coping skills as a child, so too can you unlearn old patterns that no longer serve you. Don't be discouraged by the knowledge that our brains aren't quite as plastic as an adult as they were when we were children. It may take commitment and perseverance, but you can learn new skills to free yourself of the emotional and physical trappings of anxiety. These include methodologies that quiet the nervous system, raise your awareness of your personal emotional triggers, and provide coping strategies you can draw on when nerve-wracking situations arise. This may include meditation, yoga, or even cognitive behavioral therapy. Now, I really believe in targeted neurotransmitter support. Remember, the main neurotransmitters involved with relaxation and putting the brakes on a situation are your serotonin and your GABA. Now, one of my favorite choices is an amino acid found in green tea called L-theanine. Consumption of L-theanine results in an increased alpha wave brain activity, and alpha wave brain activities gives you a sign of relaxation. Usually within about 30 to 45 minutes of L-theanine consumption, there is an enhanced relaxation, improved mental focus, and mental acuity. Theanine enhances the production of dopamine and serotonin and appears to play a role in the formation of GABA, the neurotransmitter, again, that acts like a brake in times of runaway stress. Now, theanine can be found in higher concentration in something called matcha green tea. Matcha green tea is amazing, but I also recommend a supplement because it's not always possible to stop and mix yourself up a cup of matcha green tea. Now, I also like to recommend a supplement of GABA. Remember that GABA is the inhibitory neurotransmitter. It puts the brakes on. It can also help regulate sleep cycles and also your body temperature. Now, another herbal choice is something called passion flower. Evidence from limited animal and human research suggests that this supplement may be useful in the treatment of anxiety, restlessness, insomnia, and nervous disorders in general. And many of you heard of me talk about a herb called rhodiola. Rhodiola is a herb I often recommend for adrenal fatigue, but it can also relieve anxiety and supports the body during times of stress. Magnesium. Yes, I've spoke about this very important mineral in the past. I highly recommend magnesium for women with PMS and for almost everyone who suffers from anxiety. Most people find that 400 to 800 milligrams taken in divided doses throughout the day will ease their anxiety symptoms considerably. Now, another thing is inositol. Inositol sometimes is referred to as vitamin B8. It's a water-soluble fatty lipid that is required by the body for the formation of healthy cells. Inositol has also been shown to be effective in treating, in some cases, depression, anxiety, obsessive compulsive disorder, and other psychological disorders that respond to serotonin uptake inhibitors. So that's, it's maybe a lot to digest, but just to let you know, anxiety can be treated, and sometimes it's very simple to treat anxiety. Now, I've got a few questions here. Now, what would you suggest for young teenagers with anxiety? Now, we often find teenagers have anxiety. Hormones are going crazy. There's a lot of stress in a teenager's life. Now, I really like the passion flower for teenagers in addition to a very good B complex. If your teenager is a female and she has PMS, and this is where their anxiety starts to peak, definitely magnesium. So, and good quantities of magnesium in divided doses. Maybe give a couple magnesium, before she goes off to school and then at bedtime as well. Now, my doctor says I should go to yoga for stress. Now, would this be good? Absolutely. Exercise in general is good for stress, and yoga teaches us to breathe properly. Yoga breathing is a unique method for balancing the autonomic nervous system. Particularly it stimulates the parasympathetic system, which this is your break. Your parasympathetic system slows things down. So yes, yoga is a great way to work on anxiety. Now, another question I received is when I feel a lot of anxiety, I have a glass of wine. Well, this I hear about frequently. I know this probably isn't good, but I do feel better. Well, yeah. Many sufferers of anxiety unwisely seek the treatment of, alcohol as a temporary solution to anxiety. However, this is the worst solution to a common problem that an individual can seek. Alcohol is a powerful depressant. So it can take away some feelings of anxiety, but it can cause depression. Studies also have shown that consuming too much alcohol can lead to an irregular heartbeat, to a lowering of blood sugar, which actually increases the symptoms of anxiety. Now, over the 8 years of working in the clinic with women, the approach I've described has been shown to be very, very helpful. But you don't have to try everything on the list all at once. No one thing works for everyone, and your path to emotional wellness is as unique as you are. Getting a handle on anxiety before it manifests into full-blown health concerns is a very important goal. If you already have chronic anxiety, support your body, examine your past, and rebalance your body, mind, and hormones. And this will go a long way to relieving symptoms of anxiety. And if you've tried to resolve your anxiety in the past and have yet to find relief, we encourage you to try again and to keep going. Just imagine how powerful you could feel if all the energy that's been fueling your anxiety and fear was instead unleashing your life, affirming in a positive way. So please join us next week when we'll be talking about high blood pressure, cardiovascular disease, and natural ways you can support your system. Until then, take a proactive, natural approach to staying healthy and happy.
That's it for today's show. We hope you got some useful information that will help you stay healthy and happy. If you have any questions on this week's topic, you're welcome to contact Debbie directly by visiting her blog, where you can post your questions and have them answered. If you have any suggestions for future shows, we'd love to hear from you. So till next time, stay healthy, be happy, and keep on learning.